Thank you, Senator Murray. Senator Paul.
Dr. Fauci, you mentioned remdesivir, and I'm intrigued by the fact that they say that it's effective against MERS, and SARS in animal models. Do you take that as a very encouraging sign that it may work in humans too?
Yes, I do. I do.
Okay. With regard to the children, I think it's fascinating that there aren't many cases, and I would suspect that it would be improbable that they're not being infected, that
Correct.
somehow they have some blanket immunity. One important thing of maybe putting this into perspective and maybe putting a better look on the overall outbreak would be if we had numbers. I don't know if someone would suggest to China that they do some random testing of kids in a real hotbed where there's a huge number to see, because if we got 10,000 kids that weren't getting sick or 100,000 kids, our percentage of fatality would go way down.
Right.
Do you have a comment, Dr. Shugat?
Yeah, there are some data about that attack rates may not be as, zero in children, but they may be asymptomatic. So that there are data from a few places that are looking at that.
It seems like
And-
more
and-
likely that they're asymptomatic
Yeah.
or less symptomatic.
I think we're going to get some data from the Chinese. They've actually been now quite cooperative in sharing data. We had a group that was under the auspices of the WHO that went to China. There was an individual from the CDC and an individual from the NIH who have now returned, and we'll soon get a good look at the report of what they've had. And that was one of the questions we asked, because as you mentioned, Senator, that is a very important issue.
With regard to treating the severe and potentially fatal cases, in bacterial or viral infections, it seems sometimes, it's sort of trying to fight off the cause of the infection as well as the body's response to that. In some bacterial infections, steroids, like with the flesh-eating strep, sometimes you actually give massive steroids in the setting of an infection, and some of these people survive. In the fatal cases, are they finding that steroids in addition, well, we don't really have an antiviral treatment, but are they using some steroid treatment in the real severe cases and having any success?
They've done it in an empiric, non-control way, and it doesn't seem to be any difference that there's any effect, positive or negative.
Right. Well, I guess in a bacterial infection, we would never do it unless we were also giving antibiotics. So if you had an antiviral plus steroids, might be a different scenario. Thank you. That's all I have.